The second case study for diabetes mellitus type 2, what do we have here? We have a significantly overweight 48-year-old woman who had high blood sugar and cholesterol levels 3 years ago but did not follow up with a clinical diagnostic workup. Today, she presents complaining that her left foot has been weak and numb for nearly 3 weeks and that the foot is difficult to flex. What kind of symptom is that? Peripheral neuropathy. Peripheral neuropathy. Pins and needles in hands and feet. Numbness. She reports that she has been very thirsty lately and gets up more often at night to urinate. She gained 15 pounds in the last 6 months alone. So, what is the significance of this patient's cold feet and diminished pulses in the lower extremities? This means that this patient has a peripheral vascular disease. Don't forget, peripheral vascular disease is one of the macrovascular complications of diabetes. To have a peripheral vascular disease means that you have problem as well in your coronaries and problem in the cerebral blood vessels, and you're vulnerable to a stroke and you're vulnerable to a heart attack. And this is a common chronic complication of diabetes. And this can lead up to gangrene of the limbs. What are some of the patient's signs that support a diagnosis of type 2 diabetes mellitus? Here you have a lot. Here you have a lot. The signs are the blood sugar levels. The signs are the sensory response to light touch, the peripheral neuropathy, and we have also carotid artery and abdominal bruit. Bruit means what? Noisy blood flow in an artery. Why is it noisy? Because the artery is some kind of a narrow lumen. Why is it narrow? Because there is atherosclerosis. Why there is atherosclerosis? Because diabetes predisposes to atherosclerosis. What are the risk factors that predispose this patient to type 2 diabetes mellitus? The patient was diagnosed with gestational diabetes during her 4th pregnancy. This is a risk factor. The 4th child weighed more than 9 pounds at birth. There is a positive family history for type 2 diabetes, 2 relatives. The patient has obesity and the age is older than 40, and she's a Native American heritage. All these are risk factors for type 2 diabetes. What are some of the symptoms that support diabetes here? Don't forget polyphagia, polyuria, polydipsia, and the peripheral neuritis symptoms, weakness and numbness. What are the blood chemistry lab results that strongly support diagnosis of diabetes? High fasting, high hemoglobin A1C, and high blood insulin concentration. How come we have high insulin concentration in type 2 diabetes? Yes, because the problem is not insulin deficiency, the problem is insulin resistance. So to compensate for this insulin resistance, your pancreas will increase its insulin production. It's like you're talking to someone who cannot hear you. So you try to talk loudly. You try to talk more loud so that this person can hear you. So the pancreas is talking to resistant tissues. So the pancreas is going to try to talk louder, and the pancreas will release more insulin until eventually it becomes exhausted. Why do stress and infection promote hyperglycemia in patients with diabetes in general? Because they release the so-called stress hormones. The stress hormones are the catecholamines, the cortisol, and I can add to this list glucagon and growth hormones. All these are stress hormones. They increase your blood glucose levels. Cortisol stimulates gluconeogenesis in the liver and inhibits the uptake of glucose by different cell types, and so do the catecholamines and glucagon and growth hormone.